And welcome to a very special edition of Eyewitness News at 6:30.
We're addressing your questions about the ongoing coronavirus pandemic. We are joined now by Dr. Dani Hackner, Chief Clinical Officer at Southcoast Health.
Doctor, welcome. Thank you for taking out some time. We've heard you have a lot of experience. Obviously, you worked with Hurricane Harvey victims, also other epidemics. But when you're talking about the coronavirus, I think the option is here to keep people calm because so many people are panicking.
Yes, folks ought to get a little knowledgeable about COVID-19. There are some great resources available. Folks should go to cdc.gov. There's great information for patients, for providers, and for families to protect themselves by taking some concrete steps on hygiene.
Now, when someone has to go to the hospital, doctor, what is that process like once they get there?
So the important piece is that the hospital prepares ahead of time to make sure that we can identify folks most at risk from infection. So our waiting room in the emergency department is segregated between folks with respiratory symptoms and those without. Our staff at the front are prepared with masks and questions to make sure we identify patients early. And even once patients are triaged, if we suspect that someone may have COVID-19 or another infectious entity, another viral infection, we quickly get them into a solitary room, a closed door with appropriate protection. And then providers with appropriate protection are able to sort out whether or not that patient is very sick and needs immediate intervention or can go home.
You know, Dr. Anthony Fauci of the National Institutes of Health said, quote, awful lot of challenges with this, a lot of unknowns with this virus. What are the basic unknowns that Dr. Fauci is talking about here?
Well, I would say there are some knowns. We know from the experience in China and other countries how long it takes to present with symptoms, and most patients do present with symptoms in about 5 days, although the range is 2 to 10, most by 5 days. What's not known is after you are infected, how long it lasts. And there are many patients, especially young patients, children, who do very well, and it's milder and not life-threatening. But there are many patients, older patients with chronic diseases, where it can be life-threatening. And while we know that it's more risky for those patients, we don't know enough to really predict the duration and the severity in some of those categories.
And that's also kind of on par with the viewer question that we just got. If you're able to track this illness, doctor, how likely are you to recover from the coronavirus?
Well, the vast majority of young, middle-aged folks are going to do very well.
Okay.
It's not the flu. It's a much more severe, more infectious entity, but it's not disproportionately affecting younger people. And so folks should be cautious because we do not want to infect other folks. We don't want to spread the disease. We do not want to affect vulnerable populations. However, most folks are going to do well. And our goal in healthcare is really to target many of the vulnerable folks, make sure that we can abate disease or intervene early, and access to care is an important piece. So folks who are truly sick, who have high fevers, lower respiratory tract symptoms, should be coming into our emergency departments to be seen. Folks who have mild conditions like cold-like conditions really should be staying at home so we can preserve our resources to care for patients.
So you're talking about somebody with pre-existing conditions, so that could be someone of any age. It doesn't have to be an elderly person.
That's correct. If you have diabetes, you have chronic kidney disease, if you have been treated for cancer and are immunosuppressed, if you're receiving strong medications for arthritis that suppress your immunity, all of those categories of patients can be more vulnerable to viral disease, especially COVID-19.
So you're talking about stopping the spread and getting people checked out. We keep hearing about people who are self-quarantining. What does that entail, and who should be doing that? Because you could come in contact with someone who would come in contact with someone who came in contact with someone who has been diagnosed with the coronavirus. So how do you determine whether you're supposed to self-quarantine or not?
Let's talk about it practically. If it takes about 5 days for this disease to present itself after an exposure, let's say you were contacted with someone who came from Italy. So self-quarantining is simply waiting at home, taking care of yourself at home, not exposing yourself to others until you either present with symptoms or you get beyond the period where you would have infection or were likely to develop infection.
Okay.
But what does it mean when you self-quarantine? In my family, we have 4 kids in the house. We would not want one of the adults who was self-quarantining to be around the rest of the family. Now, it's tough to do, but you'd want your own room. You'd want to have good hand hygiene. You wouldn't want to share any contact. And that's a little bit difficult, but let's say you had an older patient in the home who came back from Italy, vulnerable individual, because of the age alone. What we'd want is, say, for an older parent, is for them to really be segregated into a separate bedroom, separate part of the house, until the risk goes away. And to be completely safe, the CDC and others have set a limit of around 14 days to present with symptoms. And so it's very difficult to do for some folks, but in individuals where there is a risk of infection, those who've been exposed to COVID-19, have traveled to one of these very high-risk areas, it's very reasonable to do that. And folks should just take some steps so that you can be at home for a time period if needed be.
Okay. And, you know, that's the misconception. Just listening to 2 people when I was getting a coffee yesterday, they were talking about self-quarantining. They thought that they had to leave the house and not stay in the house with relatives. You could just stay in your own room, your own section of the house then.
That's correct. And what do you do? Well, we should all be hand washing. If you've been to the drugstore and you can't find an alcohol sanitizer, one of those that I used here just before I came on to the set, you should use soap and water. It's better. It lifts up all those proteins and viruses off your skin, and you should be doing that frequently. And for someone who was self-quarantining, you would do the same thing. Flat surfaces, easily cleaned with Lysol and Clorox type cleaners. But if you don't have those available, 4 teaspoons of bleach in 1 quart of water is sufficient, and that cleaner will disinfect a surface. But if you don't remember any of that, just go to cdc.gov, great website, and they have that information available to you.
We've had pandemics before, H1N1, swine flu. Why is this one a little bit different than the others?
Well,
do we know?
Roughly, for every 2 patients infected with flu, about 3 are going to get infected with flu. With COVID-19, it's much higher. It's not as high as measles, but it's high. And so that's one of the problems. The second problem is that the mortality in flu was about 0.1%. So roughly 1 in 1,000. COVID-19, we believe, is in the neighborhood of 2 to 4%. And in aged patients or immunosuppressed patients, patients with chronic diseases, it may be much, much higher. So it is something to be concerned about, but there are practical steps we can take to reduce the burden of organisms around us, exposure, and most importantly, protect our most vulnerable members of society.
Doctor, we're seeing governors and mayors across the country, including here in Rhode Island with Governor Gina Raimondo, saying she doesn't want people at gatherings of 250 people or more. Providence Mayor Jorge Elorza came out last night and he said, I don't want people at gatherings of 100 people or more. It's this whole concept of social distancing. So we have a question from a viewer. Are there cases in which social distancing has stopped or slowed the spread of the coronavirus or a virus in general?
Take a look at what Korea did. South Korea deployed very active surveillance and separated folks actively. And the mortality dramatically declined. They, like the United States now, but even before, ramped up testing, which enabled identification of people and separation of people. The social distancing by itself is not enough, but it is an important step to protect. And why? Because it's about 6 feet that droplets travel that infect patients. And so if you can stay 6 feet away, if you're a vulnerable elder, that protects you to a large degree. We know, for instance, from the place where it didn't work in the South Korean church, folks were very close together, and that put a lot of people at risk. So we do recommend, especially in vulnerable populations, older individuals, to maintain social distancing. But we're also recommending that we should not have large meetings and crowds, and so Southcoast has done that for all of our meetings. We are not having any large meetings. We're moving to teleconferences. We already had a fair number, but we've gone in a large way to that. We're standing up new platforms for teleconferencing with really endless video contributors. So, you know, I think there are a lot of things we can do, and the private sector has an important role to play as well in reducing the need for folks to congregate, aggregate. I'm not traveling this month to a board meeting at a national meeting because we don't think it's responsible. Our organization believes that now's the time to pause and avoid any risk, either from the travel or congregating large numbers of folks.
And with technology today, now even students, they're going to be going online for classes, meetings are online, so there's no hand-to-hand contact when you really think about it. So.
Yeah, and I actually enjoy that face-to-face contact, that in-person contact, but we have to be reasonable. Now's the time for us to sacrifice a little and make sure that we protect one another.
All right, we have much more to get to, but for now we're going to send it to a break. Welcome back to a special version of Eyewitness News at 6:30. We're taking your questions about the coronavirus to Dr. Dani Hackner, Chief Clinical Officer at Southcoast Health. A big question, Doctor, right now. What should people be stocking up on? I went to the grocery store this morning. Meat was gone, toilet paper, paper towels were gone. Should people be stocking up on those things or vitamin C during this time? What helps?
So let's start off with vitamin C. There's no evidence that vitamin C will protect you against viruses.
Okay.
And there's not a lot of evidence on vitamins in general. So if you have a real need and your doctor says you need to take a certain vitamin, sure, get your supplies. But as far as other supplies, you should have enough at this time of the year and in general for a week or two in the house. And 2 weeks is reasonable. It doesn't have to be fancy, but we're in New England, it's still March, and it's always possible you could have a freak storm, you could have a power outage. So having 1 to 2 weeks of food and water in the house is just reasonable. Do you need to stock up on any other particular supplies? I think folks have rushed to certain supplies like toilet paper out of nervousness, out of fear. And there's no shortage of those paper goods. But what we recommend is just being reasonable and working through what is just a pantry that allows you a safety margin any time of the year.
I think people are panicking because we're in uncharted territories, really, when you think about it. Here's a viewer question for you, Doctor. Once recovered, how long should a person remain in quarantine?
Well, that should be up to the doctors in that situation. Usually, folks who are self-quarantined or asked to self-quarantine, it's 14 days. And that's because it takes about 5 days to see the symptoms of COVID-19, but up to 10 days. So that 14 days gives you a safe margin.
Okay, we keep hearing the phrase, and I keep seeing the chart of flattening the curve. What exactly does that mean?
So I think Dr. Fauci explained what the typical pattern of an infectious disease is. And what happens in an infectious disease is you begin to spread, And when it is highly infectious, it's actually starts out fairly flat and then becomes exponential. And so the hygiene approaches, the social distancing, the testing, and intervening on vulnerable populations are all aimed at flattening that curve, preventing excess infections and excess mortality. We know we cannot prevent COVID-19 completely, but we can prevent mortality, and we can prevent excess numbers of cases through some of these measures.
And the governor asking people not to go to any nursing homes to see loved ones, one of the reasons there. Some encouraging news. Let's bring up some encouraging news here, Doctor. We know that with the new coronavirus from Group B, same family, I guess, as SARS, was the first reported cases were like pneumonia. That was at the end of December. By January 7th, we identified what it was. That was done fairly quickly, correct? So that's got to be a positive in all of this.
That's right. And, you know, we had sequencing done on it. The World Health Organization developed tests. And then the CDC developed tests, and it took us some time, but we eventually rolled out to all of our states and now to commercial testing companies. So we do expect in the coming week a quite marked increase in testing capability, and that's very, very positive.
And we have an important viewer question for you right now, Doctor. That viewer says, I have a compromised immune system since I had a lung removed due to lung cancer. I went to the store today for the first time they were out in 10 days. Do I need to hibernate until all of this passes? I mean, we don't know when this is going to pass. So what do you do?
Yeah, you know, I think it's important to look at each situation in its details. It's hard to say, you know, from my position, not knowing the exact details of that particular person's condition. But if you do believe that you are immunocompromised, say from cancer, it is important to minimize your social contact. Yes, you may need to go to the store, but wash your hands in the cart before and wash your hands after, and just keep it brief. You know, minimize places that you know you will be closely packed with other folks. You know, the symphony, sports events, many of these are now canceled, but there's still many situations where someone might be close to another person. And so, yes, we do recommend that folks at risk take precautions and be even more careful than others.
And every case, obviously, is different, too, Doctor. We're going to take a break. When we come back, we'll have more with Dr. Dani Fauci from Southcoast Health right after this.
Yeah.
Hackner, right after this. And welcome back to a special version of Eyewitness News at 6:30. We're taking your questions about the coronavirus. Dr. Dani Hackner, Chief Clinical Officer at Southcoast Health, joins us. Here's a question I'm sure you've gotten. This is a viewer question. The flu kills more people. Why should we be worried about this?
So this is a great question. So in 2017, we had 20 to 60,000 deaths due to flu. We had probably over 40 million folks with flu. And now with coronavirus, we have many fewer folks. But because the mortality rate is so much higher, 10 to 30 times higher for coronavirus, this virus, as it spreads through the community, can outstrip even the mortality, the deaths from flu. So we're concerned about protecting any life. And so under these circumstances, we really want to employ some of the same things that work for flu, such as hygiene. So at Southcoast, for instance, we've put hand hygiene even last year as one of our top priorities. It's even on our board members' scorecard, our leads scorecard. And the community really needs to do these hygiene activities to really protect themselves from any life-threatening virus or infection spread by contact or droplets.
While we're talking about the flu still, we have medical professionals telling people at home, if you haven't got your flu shot yet, you should still go out and get your flu shot. It's March 13th at this point. Should people still be doing that?
Yes. So if you haven't, please do. We know it works. It's safe. It reduces the duration of illness. And while it's unusual for COVID and flu to co-infect, that is something that would worsen the prognosis of a patient.
Is this a lesson learned type of thing that moving forward, we're talking about coronavirus this year in 2021, this is the way to approach to prevent the flu?
That's right. You know, we may see reduced spread of flu through hygiene practices. It may be hard to tell since we're nearing the end of the season, but that may be a silver lining in what's a very dark cloud, that we may be limiting other infections through these good hygiene practices.
All right, Dr. Dani Hackner, thank you so much, the Chief Clinical Officer at Southcoast Health.
Thank you very much, and make sure to head over to WPRI's Facebook page right now. Our conversation continues. If you have any questions, please give them to us. Enjoy a good night.